So this is Nick. He is a 6-year-old Yorkie who presented with the inability to use the back legs. And this happened 1 week ago. And the owners, the dog was receiving treatment. And so this is a lesion that's been going on for at least a week. The dog's not getting any better. Presented to us today for inability to use the back legs, loss of proprioception, and we do have ridiculous reflex, nothing, there it is. So right here, courses up probably about right here. I cannot get any pain on palpation, as this has been going on a week and the dog's already been on meds. As far as superficial pain, he's not like that, so he is able to feel that. And so, just make sure. Yeah, it's very uncomfortable. We do have some pain. We're going to apply the brace. This guy really wants to pull his legs forward. He's really resistant to putting this on. Really wants to pull his legs forward. So we'll apply the brace here, make sure it's on straight the way we want it. I'm going to start loosening, opening these up at the same time. Get some good pressure going. So let it set like that. Up a little bit here. Actually, could probably go down a size really with him, but this is all we have for now because we can get some. These are just prototypes, so technically it would be better if he had a smaller size. But we'll really stretch him out. I want to stretch him out pretty good since it's been going on a week. Just definitely want to see if this is going to help him at all. So we'll leave it at that. Take the set screws off this one just because I don't have, because of how small he is. I want to make sure that. Okay, we're going to leave him like that for 6 to 12 hours. We'll take him off, we'll reevaluate, and we'll see what happens. It's 48 hours after treatment, but the dog's been a week out. So a week and 48 hours. We are not able to use the back legs. I'm not sure we'll be able to regain function on this guy. He is pooping and he is peeing. So. Okay, so this is Nick. Nick presented about a week and 3 days ago for inability to use the back legs. This is his 3-day post-treatment here at the clinic with the brace. He's been on muscle relaxers and some pain meds or some steroids starting about a week ago from another clinic. But today he's still not able to use his back legs, although his left leg, he is having a little more use out of it than normal. He does withdraw it a little bit better. He does pull it up for himself, whereas the right leg, we're still having some deficits, more so than the left. So I would consider that improvement, that we are getting a little bit of perception back into the left rear leg. We're actually going to put the brace back on him, and because it seems to be helping him some. He'll actually even put some weight on this left rear leg, whereas if you look at the right rear leg, he will not. So a little one-sided now, but we'll go from there. So this is Nick. Nick has been here for 6 days at this clinic, and we've used the spinal brace on him on and off for 12 hours. So we put it on for 12 hours, we take it off for 12 hours, we put it on for 12 hours, and we follow that rotation. Nick came in to us not able to even use the back legs. and he's still not really using the back legs much. We saw Nick 1 week after the injury, so it's been 1 week in, and we've been treating him for about 6 days, and his left leg function is better than his right, but he's got a little bit of muscle tone in his left. He'll actually stand for you, not very long, but he does have some strength in the back left leg. Nothing in the right rear leg. That one's pretty much not doing much for us, but on the left one, we have a good withdrawal. He's got lots of good tone. He's still missing some of his proprioception, but as you can see back on the back side, his right rear leg is not having much for us. So we're really trying to work with this left rear leg to try to get it rehab back up to where maybe he can use it again, and we're going to kind of go from there. I'm just going to sit this here, see if I can set him down and get him to at least stand up for us. If I place his leg, see if he'll stand. Basically, I'm not holding him on the other side. I'm just have my finger out, and you can see he is supporting his weight. I'm just have one finger pushed on him, just pushing his weight back over to that leg, and he's about to sit down, and he just sat down. So he is pulling the leg up on his own a little bit. That's definitely an improvement. It's not great, but I'll take it. We're going to actually put the brace back on him to give him a little bit of support, and we'll go from there. So this is a week and 8 days after. His right leg is not working very much, but he will use his left leg. He will pull it up and he'll pull it back and actually try to use it a little bit. Maybe he'll demonstrate that here in a second of how he's able to pull it. So it's very, very, very small, but it is something which we'll take. Hey, bud. Come here. He'll even almost try to stand up on it occasionally. Come here, Nick. Come here, Nick. Hey, buddy. Come here. Let's see if I can get him to stand on it some. See how he's pulled it in as compared to the other side. If I actually pick him up. Actually somewhat stand on it. And the right side is just not working for us at all, but he'll kind of sit down on it like he just did. So I think with a lot of time, a lot of physical therapy, we may be able to get that left leg to start working for us a little bit. We're using the back brace to more support his back, and actually we'll send it home with the owners so that they can use it. The right rear leg, not too sure what we'll do with it at this point, but that's what we're at. We're swimming Nick, and he is actually able to use that back leg whenever we start to take the weight off of it. As you can see right here, he'll actually pull it up a little bit. He's moving around some, and so we're doing pretty aggressive physical therapy with him, as well as the brace. See how he's moving that leg? Actually moved it really well right there. He's about a little over 2 weeks out from the initial injury. He's able to use that left rear leg a lot better than the right rear leg, but we've been swimming him every day, trying to, right there, he is using that left rear leg. Right one's still not doing as well as we'd like, but I think if we can get his left one working good for us, you see how he's using it really well there. I think we'll hopefully have a fairly complete recovery on the left one. Then we'll have to talk to the owner about what to do with the right one. So just here's a little video of swimming him as he's using that leg a little bit. So we'll just keep going with him. Hopefully he continues to improve.